I think they should be able to put in place a testing protocol and a protective bubble around these players where they should be able to play sports. I think the most difficult aspect of that will be getting the players to conform to certain activities in their personal lives during the season, where they're going to have to limit certain activities in order to make sure they don't come in contact with the virus outside of the setting of playing the sports. But they should be able to do this. I think the sooner they do it, the better, because it's going to get more difficult probably as we get into the fall and the winter. But certainly right now, as the prevalence is low, as the epidemic is subsiding to some degree, they should be able to get back to playing sports. Playing with fans is another question. That enters a whole new dynamic, how you protect the fans in the stadiums. But the players themselves, you should be able to protect, and they have enough resources to do that.
I know you're advising many states on how they've reopened. Have you had any conversations with any of the league commissioners or executives on what the future of sports may be?
Not yet. I have a couple scheduled with some of the individual teams coming up, but I haven't had a chance to talk directly with them yet. But I would tell them the same thing. I think that there's a way to implement, very strict testing protocols and a protective bubble around these players where you should be able to limit the likelihood that you get coronavirus in the clubhouse and on the sports teams. Obviously, these players are very close together, so if there's one case, there's likely to be more cases on the field. But I think you should be able to keep it out of the clubhouse so long as you're able to put in place good testing protocols, a bubble around the players, and get some control over what they do off the field as well.
Let's talk about the current state of affairs around the country. You tweeted just before we came on the air tonight, some states are showing rising cases and rising positivity rates, and that suggests expanding outbreaks. Can you expand on what you're talking about here?
Right, that's exactly right. So, a lot of people are saying, well, the case counts are going up because we're testing more, and to some extent that is true. We're testing more, so we're capturing more cases. But in some states, as the case counts go up, the positivity rate's also increasing, the percentage of people who are testing positive. So that suggests, it doesn't suggest, it shows an expanding outbreak in these states. So you look at states like Arizona, Florida, Texas, Alabama, Georgia to some extent, California, you're seeing the positivity rates also go up as the cases go up. So they have outbreaks underway, and they're going to have to get control of this. Alabama has 1,000 cases they've hit, which is a lot for that state. Positivity rates creeping up. Arizona, the positivity rate's around 16-17%, which is quite high. Texas and Florida around 7%. So these positivity rates are going up. They do have outbreaks underway. They have a chance to get control of it, but they're going to need to do it over the next week or two because you can easily lose control, as we've seen.
There's also the issue of, a second wave, so to speak, or whether this is the first wave that was never really contained. You say this is not a second wave. Texas seeing its highest number of hospitalizations since the whole thing started. And you tweeted again today, unless states with large number of cases can isolate and target those outbreaks, they could get out of control. How much in danger tonight are we of that scenario?
Well, Texas still has an opportunity to take action. They're going to be expanding the number of patrons that they allow into closed venues like restaurants. It's hard to eat outside right now. It's 100 degrees in Texas. But they need to rethink that and slow some of the reopening because it is expanding in certain cities like Houston and Austin. So they can target measures in those cities to try to get control of this. But, this is a dangerous situation. This is not a second wave. These are states that had smoldering infection all the way through. They never really crushed their infection, and now they're seeing a resurgence as they reopen, as it gets hot and drives people indoors. You're starting to see the infection rate go up. And so they're going to need to find ways to offset this and mitigate it. The hospitalizations are going up, too. Texas is adding about 100 hospitalizations a day right now, which is a lot. I think what the governors are looking at are those hospitalization rates and resource utilization in their hospitals, and they're not seeing their hospitals maxed out right now or even being close to maxed out. But what we've seen with this infection is once it reaches a certain point, it starts to explode. And so once they get a certain number of cases in those states, in dense locations, they're going to lose control of this. So they need to intervene right now.
So in terms of the reopening, and you write in your Wall Street Journal op-ed today that public officials need to focus on, quote, building public confidence and minimizing wariness. Do you think they're doing a good enough job to date of doing that?
Well, the public's wary, and nobody wants to go back to shutdowns, and governors and elected officials don't want to go back to shutdowns. I don't think we have to, but what you need is good information about where the spread's occurring, and you need to target interventions at those locations. So again, in Texas, if you're finding that the infections are being transmitted in restaurants or bars, you take measures to de-densify those locations in the cities where the spread's occurring, maybe even close them for a period of time. So you target your intervention so you're not putting a burden on the entire economy. What we're also seeing is that the infection rates are trending towards younger populations. So older people are doing a better job of protecting themselves this time around, and it's the younger people that are going out and getting infected. We do see a trend towards younger people on the whole, comprising a larger percentage of those who are getting new infections.
I saw a study today that suggested that a mutation in the virus is making it more contagious. Do you know anything about that?
There's been various theories around this. I don't really buy any of them right now. There's no good evidence that the virus has mutated in any way that's giving it different clinical characteristics. You really need very exquisite work looking at how the virus is changing and how its genetic characteristics are changing and correlating that with how it's affecting people. And we just don't have that data. It also would be unusual to see the virus mutate this quickly and a new strain become the predominant strain and select for that particular strain. The initial strain was contagious enough to really occupy the space, if you will.